you were a big advocate for accepting the Medicaid expansion funding, and Governor Meade had put that in as a request as part of his budget. It got voted down this earlier in the week by the Joint Appropriations Committee. First of all, tell me why you were a proponent of the Medicaid funding and accepting that.
Well, the main reason is we estimate about 20,000 people in Wyoming that could benefit from expansion of Medicaid. Mm-hmm. When you take that down to the Albany County level, our estimate is roughly 800 to 900 people that could be affected by expansion. In the time of state funding problems, it also actually would be a net add to the state's budgets. The way that comes through is 100% of the care costs are covered by the federal government, 50% of the administrative costs are covered by the government, but then there's other costs that go away. So the net effect was a positive to the state budget, which I thought that might be a key feature, but it looks like that did not carry the day.
Why do you think they voted against it? And it seemed to be a close vote, maybe not a heated debate, but it was a 7-5 vote. Why do you think the JAC might have, acted in this regard for right now, at least?
I think it really comes down to distrust of the federal government, and I think it's been that all along. And this is really kind of a referendum on Obamacare or the ACA, and that's what I think it comes down to. And afraid that the feds will change the rules down the road, like I've talked with a few representatives, and that's what's happened in other programs, education, road funding. So they have a little right to be suspicious of the federal government. So I can't exactly say that I don't understand what shoes they're filling, but we know that would add quite a bit of money to the economy if we were to take and expand Medicaid.
So if it would have passed, how would that have affected things locally at Ivinson Memorial Hospital, for instance?
Well, so the way that plays through is that'll provide insurance for people that do not have it. So this covers a gap of people that are actually make more money than to get on Medicaid current standards, but really don't make enough money to afford, to fund their own health insurance through the expansion Obamacare. So that's what would happen. And then when they come to seek care, there would be an insurance payment when they come in, either to the ER or to the physician office, and it would encourage them to actually seek more care. If you don't have health insurance, you come when things are real bad, and that can have dire consequences for some.
And we're visiting with Doug Faus. He's the CEO at Ivinson Memorial Hospital this morning here at Laramie Live on KOWB. I'm David Suttle. Glad to have you along on a Friday morning, ladies and gentlemen. It also, if I remember correctly from Nick's interview with you, it would have affected the downtown clinic, and it would have maybe closed that, which you weren't necessarily against. Why? Because when you say closing to people that don't understand the background of closing, sometimes that has like a negative portrayal to it.
Yeah, so if you talk to the people that lead the downtown clinic, their goal is someday to be out of business. And that means that the nation's fully insured. And so the way that downtown clinic operates is they accept no insurance payment, so it's all free. And so if there were insurance payments to come forward through Medicaid expansion, and that would basically cause their business to go away. And they're 100% of support of that. They've said that to me. So I'm not wishing them bad luck. I'm just basically wishing them to fulfill their mission.